My name is Nick. I'm one of the psychiatric PAs here at Mindful Urgent Care. I like working in psychiatry because I actually have an impact on somebody's life. I'm able to see them go from certain situations where they're not doing well at all, they're massively depressed, have suicidal thoughts, thoughts of harming other people, psychosis where they hear things or see things that they believe is a reality that is not here with us. And I see in a quick timeline progression that changes them from being ill to being well and able to function and return to their families and return to their daily lives and return to their spouses where they're able to take care of the people that love them and be part of their world again. We'll sit down, we'll talk about what problems are causing you to feel the way you do. I would ask many questions in regards to your social aspects of your life, financial, figure out what's causing you to feel the way you do, when it began, what your triggers are. And when we go through all that together and I assess, where the main parts of what's causing you to feel depressed, then we can talk about options and what's going to make you feel better and how you're going to feel when you start this medication. That it's not going to change your intelligence and your wit and your humor, and that you're still going to be you when I put you on a medication, but you'll be able to push away the triggers or the thoughts of the triggers a little bit easier. When somebody is laying down in bed and they just have negative thoughts over and over and over, and it's something that hijacked your brain that makes you act in that pattern. And one thing that does definitely help with that is therapy on how to short circuit that thought process of negative thoughts just looping around and around. And while I can help you with certain medications, like I said earlier, the adding together of therapy plus medication can definitely help you stop ruminating, have less negative thoughts, and thus sleep becomes a lot easier when you go put your head down on a pillow. I have some patients who, day one, they feel that once they take the medications that they're starting to feel better, but clinically and typically from what studies show us, it's typically 4 to 6 weeks that the medication gets into the plasma where it's able to cross the blood-brain barrier and then get to the appropriate amount of receptors in your brain where you'll start to feel overall well-being and happiness. It's absolutely normal for people to be depressed and in certain situations of stress or things that are happening in their life, loss of a loved one, loss of a pet. These things impact people because that's just normal human life. Yes, feeling depressed, that's the cycle of life. You have moments of happiness and you have moments of sadness. It is normal to have those moments in time.